Hi there.
Hey, Mike.
I took some
Yeah.
notes. I had a couple of things I wanted to
Okay.
go over with you.
Cool.
Tell me
All right.
what a typical day and or work week looks like for you so we can share
Right.
with people.
Okay. Well, I usually get up at 4:30.
Wow.
At by 5 o'clock, I'm over on a stationary bike doing a workout and doing an upper body workout and a lower body workout.
Mm,
And I come back, take a shower by 7 o'clock. 7:30, I'm over at the office. Catching up on paperwork and finishing charts left over from the day before.
right.
And 8 o'clock, well, if I have time, I'll go see patients in the house. At True North Clinic, we've got 20 apartments. We've got inpatients,
Wow.
we have about 40 to 45 inpatients. And at any given time, about 15 or 20 of them are mine. So I go
Uh,
see my inpatients. And then I come back and start seeing my day's office slate, and
right.
about half of them are inpatients. I see everybody for an hour at the beginning, take a
Wow.
good history, a physical exam, and find out if they're staying at True North what the appropriate program would be. About half of them just eat our lovely low-fat plant-based diet,
Right.
all whole foods, no oils or flour products.
Right.
About a third of them will, if they got runaway high blood pressure or diabetes or inflammatory joint disease, we'll put them on a water fast
Mm,
and supervise them. We check them twice a day. We wash them like a hawk, order initial
right.
blood tests, and repeat those every week. And we have interns at the clinic, so the intern knocks on the door at 8 in the morning, 4 in the afternoon, checks vital signs, see how they're doing, and reports to me by the
Right.
computer. And I'll do exit exams. People who are leaving, everyone who comes in gets an admitting exam with the
Mm,
doctor. That we have three MDs on staff, and they also get an exit exam. And we review their stay, go over the lab tests, and talk to them about what to eat when they leave, because that's
right.
really the most important thing. You can do a long fast and do really great, but if you go home and fall back into the chicken, cheese, and olive oil swamp, then
Yeah.
Cinderella turns back into a pumpkin within days. It's
Sure.
shocking how fast things revert to their previous state. The fast is a jumping off place to a whole food plant-based diet, so those good changes that started on the fast keep happening.
Right.
So I'll do admitting exams, exit exams. They've got a very active outpatient practice. People come up from from San Francisco, Sacramento, the entire North Bay area, but
Right.
also from around the world. We
Sure.
we have quite an international clientele. People stay at the clinic from all over the world: Israel, India, UK, Australia,
Mm,
and these folks pass through Santa Rosa for various reasons. They'll drop in and see me as outpatients. So. I see. I'll see patients. The whole work day. Wednesday afternoons, I have teaching rounds with the interns. At any given time, we have 3 to 5 interns. They're usually newly graduated family practice residents,
mm,
chiropractors, naturopaths, dietitians. That's come and stay with us anywhere from a month to a year,
wow.
and some do complete residencies with us. And we go over cases in the house there, interesting medical issues that the various patients can present with, and various approaches to handling them. And I'll also give them classic clinical situations on how to handle everything from cardiac arrests and epileptic seizures to
Wow.
fainting spells and nosebleeds, and practice basic medicine. And I
Right.
really enjoy the teaching rounds there. Those are really fun for me. Monday afternoon, 12:30, the entire medical staff gets together in the meeting room, and we go through all the inpatients in the house, and
Mm,
we present the individual person and where they're at in their stay, if they're on day 14 of a water fast or day 5 of the refeed program, whatever,
right.
and all the health professionals, the physicians, the chiropractors, naturopaths, massage therapists, everyone has input into the best management of that patient.
Right.
And the days are chock full, and the week goes by pretty fast.
Sure.
But a lot of people get seen, and hopefully a lot of people get help. So
Right.
that's pretty much the standard day. I don't get home till 7:30, 8 o'clock, and time to sit down and answer my own emails and work on my book, and even kiss my wife, and sometimes even have dinner. And by 10 o'clock, I want to be horizontal in bed, and for the clock to go off, I'll go off 6 hours later and get up and do it all again.
Wow.
So that's my work day.
Unbelievable. You mentioned a book. I was going to ask you about that. Where are we at on the book?
Right, yes. Finally, for years, Dr. Klaper, you need to write a book.
Right.
And
that was my question.
Right, exactly.
Yeah.
And I've been very reluctant to, because of course, focus would be plant-based nutrition.
Sure.
And that subject's been done to death. And everybody from Andrew Weil, Neil Barnard, John McDougall, Nelson Campbell, or Tom Campbell, and McDougall plan, the Nelson Campbell plan. Am I going to do the Klaper plan? How many ways can you say eat plants? And so that's why I've never really done it up till now. But finally, somebody sat me down and said, "Doc, you've been in a physician 45 years. You got a ton of great stories that are all teaching examples."
Right.
And your own story from how you went from a regular blood and guts working doc in the emergency rooms to what you're doing now, trying to keep people out of hospitals and off of operating tables. That's a story, and you should tell that story and then hang the teaching cases on it and share, towards the end, my insights of how people treat their bodies, what they do wrong, and listen, here from the doctor's point of view, here's what you need to do. Here's how to take care of your gastrointestinal system. Here's how to take care of hearts and lungs. Here's how to take care of your skin, and share the wisdom that I've accumulated over the years. And tell some good stories along the way. So that's the book that's in progress.
Great.
But oh my, it's like giving birth. It's every sentence you got to work and rework and read out loud, and it may be better inverted this way. And it's like being down in the engine room at the anvil, pounding away. The writing is laborious, but it's wonderful. And if I could, I'd squirrel away in a little cabin for 2 months just write, but alas, I've got other clinical responsibilities. But the book's getting done, slow but sure. But I between 9:45 and 10 before I pass out at night, I guess.
So as far as, if I just sort of list some of the quote-unquote impossible diseases, give me a short take on your successes, or just feelings that, well, maybe that's one we really just don't know yet. Cancers of various types.
Right. Well, until recently, until 2 years ago, I said, well, cancers, once they're established, there's really not much you can do about them. Yet, I would read reports about patients with breast cancer who did a fast on a low-fat plant-based diet, and like Ruth Heydrich in Hawaii, and her breast cancer metastases to her brain melted away. And there are now many reports of that. And I have 2 patients of my own who came in with advanced lymphomas, and done one water fast. One patient, Yvonne, she came in with lymph nodes the size of hen's eggs in her groin, under her armpits. She did a 28-day water fast, went on a squeaky clean, pure plant-based diet afterwards, and those lymph nodes just melted away. I put on gloves and checked for 5 minutes. I could not find a single one of them. The MRI scan proved that. I had another lady with a lymphoma mass in her abdomen, for biopsy proven, and whole food plant-based diet melted that away. So I have seen malignant changes certainly disappear. But I'm not saying it's a panacea, and you've got advanced cancer shot through your tissues. I'm not saying that a fast or a particular diet is going to help that, but it's certainly, the fact that it's happening at all is just remarkable. And I still have to fight the urge to run the other way when someone comes in with Lou Gehrig's disease, with ALS, or some of these severe neurodegenerative diseases, Parkinson's. Although our colleague, Dr. Peter Sultana in our clinic, he does amino acid therapy, and he gives these folks, tests their blood, gives them amino acids to build up the neurotransmitters in their brain. He's been getting some good results with that, but those are tough ones for me. Any other ones? On Alzheimer's at this point, certainly don't know how to, you can't unscramble an omelet, and it's hard to really make that brain come right, though. Not a few people with the diagnosis of Alzheimer's really have vitamin B12 deficiency, and if you give them a big dose of B12, you can sometimes get them jolted back to consciousness there. So there's a few that are still formidable foes, but ones that I learned in med school, Crohn's disease, colitis, they never go away. Diabetes never goes away. Nonsense, they absolutely do, and I've got dozens of patients who no longer have colitis, no longer have Crohn's disease, psoriasis clears. It's just remarkable how the body can heal itself if we give it a break with healthy, whole, plant-based foods, so what it was designed to run on.
That's great. Any other thoughts you want to share? Anything you like?
Yeah, sure. Health is a verb. It's something you do every day. You create it. I had a professor in medical school said people don't get diseases; they earn them. And meal by meal, cigarette by cigarette, drink by drink, argument by argument, you generate disease in your body. Well, you can earn health the same way, and it's a matter of responsibility. You're not playing victim here, and that. Like Dr. McDougall says, people love to hear good news about bad habits. And if the news says that fried chicken is good for you, a study out of Latvia says, yes, eat more fried chicken, and we've become such pawns of the media, winds that blow. It comes down to basics. The naturopaths, naturopathic view has been right all along. It's good food. Get enough rest, get enough sleep, drink enough water, get out in the sunshine every day, do good work, you have love in your life, and your body will be healthy. You're not going to get high blood pressure and diabetes and all these things from that. And so, and I'm amazed and constantly awed by the spectacular healing powers that this body has if you just stop interfering with it. What we've seen, these diseases resolve within days and weeks. High blood pressure can go down, joints stop hurting, diabetes goes away, skins clear up, bowels start working again. So people get told, and my profession has not been kind or honest with them. Well, high blood pressure, you'll take these pills the rest of your life. Diabetes, one-time insulin always. You're diabetic, you're going to be on insulin all your life. There's such great hope. I really want people to educate themselves. Go to websites. Take advantage of the great information, the good information that's out there. I'll start with my website, drklaper.com, doctorklaper.com. Sign up for my newsletter, Medicine Capsule. It's free. But if you're just getting into this, the people watching this interview, or if you've got skeptical friends or relatives, sit them down in front of their computer or plug it into the TV. Go to the website called forksoverknives.com and see this remarkable film, Forks Over Knives. The fork is your dinner fork. The knife is a scalpel going down your chest for a coronary artery bypass. Sure. And watch that movie. You have to convince Uncle Harry. The movie will do it for you. And then check out their website. They've got recipes and transition plans and makes it easy. Same thing, we'll go to engine2.com and see Rip Esselstyn's story about how an Austin firefighter came to the same plant-based truth and what was done for his magnificent body, friends, career, etc. Go to the Physicians Committee for Responsible Medicine, pcrm.org. They got a 21-day vegetarian starter kit to help people get started. Go to the website, Dr. Joel Furman, drfurman.com, drfuhrman.com. He's got wonderful information there. Go to Dr. McDougall's website. And please, if you really want to be serious about nutrition and know what you're talking about the science of it, go to Dr. Greger's wonderful website, nutritionfacts.org, nutritionfacts.org. And there are these wonderful 3-minute, 5-minute videos that really explain in very simple language all the health topics that are swirling around today. So there's great information there. Stay away from the paleo nonsense. That's a diet of death. It kills everything it touches. It kills the animals. It kills the people eating it. It's going to kill this planet. We're designed to live on plant-based foods. And if you want some convincing, look up the talk by Dr. Milton Mills on our humans, herbivores. And he's a physician who lays out beautiful, powerful, indisputable arguments about the anatomy of this body and how we are clearly not carnivorous and on so many levels. And that'll help you feel good about not falling for the paleo nonsense.
Sure.
And so get educated. That would be a thing I would really tell people to do. Don't play helpless victim. And don't assume your doctor knows. Most of my patients know a lot more than their doctor.
Right.
Because the doctors don't want to stop eating their filet mignon, their lobster, so they're not going to tell you to do that.
Sure.
But I must admit, I don't want to sell my colleagues short. The plant-based light is going on in the minds and hearts of doctors around the world, and I'm very hopeful if this world holds together for another 10, 20, 30 years, it will be a foregone conclusion that doctors will know about nutrition, know about plant-based nutrition, and help their patients really get healthy. But for right now, the caveat emptor means buyer beware. The caveat eater, eater beware, and eat whole plant foods. Take a walk every day, laugh a lot, get as much love in your life as you can, and you'll stay out of the clutches of people like me. You won't need a doctor. We can just wave to each other on the bike paths.
Yeah, right.